I am just touching the back of her hip here, and the motion is this way. So we're just kind of rocking forward. And you want to see her undulating from her toes to her nose. And this is so nice. It's very relaxing. Anytime people have back pain, it's great. But I do this so much for my pregnant moms when they're like, oh my God, my day was, it's like, get on the table, lay down, and then tell me all about it. And it really helps them calm down. So you can do rocking forward. You could change the angle and rock down, and that can feel good. Like you can ask them for feedback. What do you like better? If you do Tui Na, you could do rocking and rolling. Woo woo! We're having fun here, and yeah, this is something. Sometimes I rock women in labor for hours, and it just be hours and hours. If she's stuck in bed with an epidural and she can't move, this is her only movement. So it's just nice, and I'll trade off with the husband every now and then. Your turn. Get up here.
And do you do it down like the side as well?
Yes, yes. Do you mind laying on your back for me?
So much for Marissa's driving